everyone, good morning. So I hope today we are enjoying the beautiful sunshine in Boston. And then also, do you know that sunshine actually helps us generate more vitamin D, thus getting better hair? So here we're presenting you Genpulse, the female health data reimagined. That's we're building a decentralized female health data economy, starting with hair. Why hair? It actually started from my personal struggle. I had a hair loss issue at the age of 21, and my background was in bioengineering. So that got me thinking, why, when you think of hair loss, it's actually counterintuitive to think of it's a young girl's problem. So we looked into the research space, and then we realized there is very little innovation and research or data collected for the early stage female pattern of baldness, while there's 40 million women in US alone that's suffering from female pattern baldness at a very young age. So here we realized fem health data is broken. It not only exploits users, bringing us solutions that we don't necessarily need, or telling us we're having cancer just because we're having hair loss. And then it also fails business to find the best solutions or the right data for drug discovery. So here we push forward our dual engine model. With our network engine that is generated from our DeepIn user. So we already have the working hair analyzer in the market that's actively selling in more than 30 countries, having 20,000 users and generating twice per week scan in the market. And then at the same time, we have the business engine. So we have trained this proprietary model based on the hair data collected from the consumers as well as the hospital that we're able to license our API to pharma company and cosmetic company so that they can integrate this customer insight analysis feature into their product chain as well. So with this dual engine model, we built this flywheel where we can acquire data, empowering user with their incentivization as well as their data insights, as well as monetize with the data, not directly selling the data itself, but selling the capacity to process the data. So the roadmap of a user would look like when they purchase this scanner, they can generate this clinical grade AI analysis towards their scalp images and later on skin images, gynecological images, optical images, or even hormone data and sleeping data. And then they can earn and stake based on their data contribution. And with earning our token, they can contribute the data itself for our data aggregation analysis towards the model training. So with that proprietary AI model, we can license to B2B clients. And then when they pay for the API subscription, they also provide the value that's backing our token. And with the value, we can not only fuel the growth of the company, but also with the token buyback and keep the token price stable and keep on going up, as well as we can redeem into stablecoin and then generate more user rewards. After all, they're looking for solutions on our platform. And here's a demo video of how it works. So with Lush Hair, we actually changed the traditional pipeline in the hospital where they need to purchase this bulky, huge table-sized device that's costing $150K. And we changed that into a portable and accessible device that they can get from any e-commerce website with only $99. And then we also changed the doctor analysis and annotation into something that's AI generated. In the past 2 years, when we worked with National Skin Center in Singapore, the Stanford Hospital, as well as Hangzhou First People's Hospital in China, we were able to collect 20,000 images annotated by the dermatologist and achieved a 92% accuracy when it comes to the scalp analysis, follicle analysis, and hair analysis. However, when we actually launched the product, we see 20,000 users onboarded in the past 11 months and generated 60,000 scans in the back end. So each scan is 7 data points. So that's 420,000 images in the past 11 months, not only 40x the result of the data collection, but also at a fraction of the previous cost. So from that, we see the amazing value tokenomics brings in our business model. So thankfully, we also achieved the dual market validation with pharmaceutical company and cosmetic company. In the past 3 months, we see our revenue skyrocketed with active pilots with Philips, HairMax, Lovejoy, Bondi Boost, as well as we signed the deals with listed pharma company and the cosmetic company to licensing our API for their further consumer insight analysis. So with this know-how that we have from hair, we can achieve this health data economy beyond hair. From the user incentive that's encouraging the data contribution and community governance, we can also have the B2B revenue used in the fund for funding R&D, buyback of our token, as well as convert to stable coins to achieve the better rewards for our consumers. And we gathered up this team that's built to execute this vision. My personal background was in bioengineering, and I was also attending a pageant in Singapore to see how this aesthetic care and healthcare can be related with vanity, but at the same time, while our technology has achieved to this level when we can live way longer, we also hope to look better while we're 200 years old. And then with that, we have all our medical advisors from China, US, and Singapore to help us achieve this goal with the medical standards and living up to all the HIPAA and GDPR data compliance. We're also backed by the VAST. We are the Solana cohort 3 for the Solana incubator, as well as backed by Virtual Venture, Time Research Lab, National University of Singapore, as well as individuals from Story Protocol, Solana Foundation, and previous chief compliance of HTX. Beyond that, we are already actively in the market. So if you're curious to find out about your hair score, feel free to reach out or just download our app. Thank you so much.